Recently, our Janine Lassant interviewed Schuylkill County Coroner Dr. David Moylan. He spoke about deaths in the county from COVID-19 and how he and his staff are staying safe while investigating cases.
We're investigating these very thoroughly. Most have been diagnosed in the area hospitals. They haven't all died in Schuylkill County because, we have major tertiary medical centers that have smaller hospitals in our county. And sometimes the patients, as they get sicker and sicker, are transferred to Allentown, Bethlehem, Reading, or whatever. But we are counting those as our cases, and we're tracking them. We've substantiated 5 deaths that involved COVID infection.
And do you have to deal with the bodies differently because of COVID?
Well, if the case is only suspected, as we had last evening, we treat them with the presumptive diagnosis, and then when they're back in the morgue facility, we try to establish a diagnosis either with a blood test and or a nasal swab, and they're 2 accepted areas or methods of diagnosis. And the deputies that are assisting me in this are gowned with impervious material, so fluids cannot absorb into their street clothes, masks, and also a facial shield, double gloves. And the mortuary pouches that we use in bringing the bodies to our facility, we use 2 pouches as an extra precaution in case there's a perforation or anything.
Are you seeing a decrease in overdose during this time?
We are seeing an increase in overdoses. And again, very tragic deaths. A lot of young people under 40 years of age. And again, we're working closely with law enforcement and the DA's office to see if we can dampen that trend.
You've been in this business a long time. What have you learned throughout this process of dealing with COVID?
One of the things I've taken away is that this is an extremely infectious agent, and it's not just being spread by droplets, coughing, sneezing, but it also seems to be transmissible by fomites. What the heck is a fomite? It is a utensil, perhaps. I've even heard of one case documented in the literature in which a salt shaker was the fomite that carried the infection to another person. So again, the CDC recommendations have to be taken to heart.